Cancer is the second leading cause of death in the United States. Most cancer deaths in the United States are due to lifestyle patterns. Recall that for men and women, death rates are highest for lung cancer. One person dies of cancer every 90 seconds. Close to half of us are predicted to develop some form of cancer over our lifetimes. Skin cancer incidence is on the rise worldwide, accounting for more new cancer cases than breast, prostate, lung, and colon combined. Every day in the U.S., close to 2 million people indoor tan. 70% of those are white females between the ages of 16 and 49. The good news: more than 8 million Americans have survived cancer for 5 years or longer. Since cancer death peaked in 1993, there has been a steady decrease for men and women since 1990. Cancer is not a unitary disease, but a complex set of nearly 250 diseases and does not have a single cause. The word cancer is derived from carcinos and carcinoma, terms first used by the Greek Hippocrates. The shape of spreading cancer cells resembles legs of a crab, and in Greek, the word for crab is cancer, same as the zodiac sign. In the 19th century, the leading theory was that a parasite or infectious agent caused the disorder, but no such agent could be found. The mutation theory arose, which states cancer originates because of a change in the cell mutation. The cell continues to grow in mutated form, and the result is a tumor. In the late 19th and early 20th century, a large number of agents, chemical, physical, biological, were found to cause cancers. All cancers result from dysfunction of DNA that causes rapid cell growth and proliferation. These cells merely tap the body of resources. Different cancers share the presence of neoplastic tissue cells. These are characterized by new and nearly unlimited growth that robs the host of nutrients and yields no compensatory benefits. Cells that show abnormal growth are called neoplasms. Tumors, a large mass of cancer cells, may be either benign or malignant. Benign growth tends to remain localized, making them less threatening. Benign tumors have the potential to crowd other cells, such as the brain, and it may interfere with the function of adjacent structures, such as choking off blood vessels. Thus, not all benign tumors are harmless. Malignant tumors tend to spread. They invade and destroy surrounding tissue, and may also move or metastasize through blood or lymph, and thus spread to other sites. Most malignant tumors can be classified as one of 4 types. Carcinomas, cancers of epithelial tissue, cells that line outer and inner surfaces of the body, skin, stomach lining. Breast, prostate, pancreatic, colon, lung belong to this class. This type accounts for approximately 85% of all malignancies. Sarcomas arise from cells in connective tissue such as bone, muscles, cartilage, and lymph. An example is Kaposi's sarcoma, a rare cancer that attacks cells that line blood vessels serving the skin, mucous membranes, and other glands in the body. It causes purplish spots in the skin, or brownish-black in people with darker skin, mouth, and lungs. It's seen among AIDS patients. Lymphomas, cancers that form in the lymph system. This includes Hodgkin's disease, a rare form of lymphoma that spreads from a single lymph node, and non-Hodgkin's lymphoma, in which malignant cells are found at several sites. 90% of new cases of lymphomas diagnosed each year are non-Hodgkin's. Leukemia, cancer that originates from blood cells. It attacks the blood and blood-forming tissues such as bone marrow. This leads to proliferation of white blood cells in the bloodstream and bone marrow, which impairs the immune system. Although often considered a childhood disease, it strikes more adults, estimated 25,000 cases per year, than children, 3,000 cases per year. Overall, mortality rates from cancer have increased during the 20th century. The leading causes of cancer mortality are lung, breast, prostate, and colon cancer. Why the increase? Improved methods of diagnosis, so a small portion of gain does not represent a real increase in cancer rates. Lung cancer rates for women have risen sharply since 1965, and for men the increase began in 1950. Cancers from AIDS, Kaposi's sarcoma, and non-Hodgkin's lymphoma have greatly increased. Control or elimination of other diseases, especially cardiovascular disease, means people are living long enough to develop and die from cancer. Increase in environmental carcinogens, for example pesticides. With the exception of lung cancer, mortality rates for cancer have stabilized during the last 30 years. Cultural variations. Keep in mind the difference between incidence and mortality statistics. Even if there are two cultural groups who have the same incidence levels for a certain type of cancer, they may not show the same mortality rates. African Americans have the highest cancer incidence rates and mortality rates of any population in the U.S., with the difference being driven more by higher rates among African American men. Although Asian Americans have lower rates of cancer than European Americans in general, their rates of colorectal cancer are about the same. European American men are 4 times more likely to have testicular cancer than are African American men. Overall, men have higher incidence of cancer in general. Male cancers have not received as much research attention as female cancers, and there is less known about the etiology or cause of most male cancers and their psychological experiences with cancer. Breast cancer is the most common cancer among women and is second only to lung cancer in mortality rates. The risk of breast cancer begins to increase at around age 30. 95% of new cases occur in women aged 40 and above. Different cancers follow different courses, and some appear to be related to stress. Some are aggressive and follow a predictable course. Others, like breast cancer, follow a more variable disease course and appear to be less exclusively affected by tumor biology and appear to be affected by other factors. Ways stress may affect cancer. Direct effect on immune defenses and on the tumor itself that may enhance tumor growth or metastases. Can increase drug, alcohol, or tobacco use. May decrease the likelihood of women engaging in breast self-exam or having regular mammograms. May lead to delay in treatment and worse prognosis. Retrospective studies linking stress and the onset of cancer have produced varied results. Retrospective studies have been criticized for the following reasons: small samples, lack of or improper control groups, such as women without cancer. Other than limits on recall, the most serious limitation is the fact that participants knew their diagnosis prior to participating in the research. This could influence the way they recall past stressful experiences. They may be more likely to recall or report stress prior to diagnosis than women who were not experiencing the stress of diagnosis. To correct for influences due to patients knowing their diagnosis prior to participation in studies, researchers have used limited prospective designs, where subjects are interviewed prior to learning their diagnosis. Although the number of stressful events reported was comparable among patients diagnosed with breast cancer and those with benign lesions or healthy breasts, the perceived severity of stressful events differed among groups. More severe events were reported by women subsequently diagnosed with breast cancer. Perhaps more damaging to life events research are timing issues involved in the onset of breast cancer. breast cancer is a slow-developing disease. From the time cancerous cells appear, it could take as long as 10 years for a tumor to be detectable. Recent life event studies usually ask about events occurring between 2 and 5 years preceding diagnosis. Therefore, researchers are not measuring stressful events that occur prior to cancer onset, but instead are measuring events that occur prior to diagnosis that may be associated with the progression of the disease. Many researchers conclude that there is no demonstrable relation between stress and the onset of breast cancer. Research on the effects of stress and progression of the disease is more promising. Research on onset suffers from difficulty of not knowing exactly when onset occurs. However, consideration of progression of disease after detection and diagnosis bears the benefit of a clearer time frame. The stage of breast cancer can be determined at diagnosis, and progression is readily measurable.